So we'll start. I just want you to know, I tend to, when I teach cases, I like to abbreviate the cases. One of the problems that I ran into when I was a student learning homeopathy is that the whole case would be presented, and that's fine. There's an exercise and there's something to present in the whole case. But there's so much information that's not valuable in a case, right? We're trying to parse out what's human specific from what's remedy specific or non-human specific, as Sankaran would say. So I take out a lot of the details or a lot of the information, a lot of the noise, a lot of the human specific information that doesn't really apply to the remedy. And I try to focus down on the symptoms that indicate the remedy. Just because one of the things that happens is if you present the whole case, especially to people that are newer to homeopathy, it gets very confusing. And I really try to minimize the amount of confusion in homeopathy when I'm teaching. So anyway, this is an abbreviated case. I think the original case itself probably goes to 6 pages, and I've abbreviated it down to about one. So we can get into it now. What I'm going to do is just go over this. Then I'm going to go over information based on the different parts of the case that I focused in on. And then we can find rubrics for the different um, sensations and different aspects of the case, different symptoms. Um, and then we'll see what comes up as far as a remedy goes. Um, if you have any questions or if you have suggestions for rubrics when we study or look at a particular symptom, then please chime in. Participation is welcome. So this was way back, it was 8 years ago, almost 8 years to the date. It was a 27-year-old female. So the chief complaint were migraines and intense rectal pain. And intense, really sharp stabbing rectal pain is called proctalgia fugax. Um, so um, she said, I've had these pains since college. I studied psychology. In my third year of school, I was at a party, a very shocking, traumatic experience that happened. I was approached by a guy and he ended up sexually assaulting me. Um, she kind of gets into the details, but I felt like it wasn't necessary to share all that. It was very traumatic. I couldn't sleep that night. All day the following day, I was crying and running the experience through my head. I couldn't stop crying, and the night and day after that happened. I couldn't stop crying the night and day after that happened. And a few days later, the headaches and the rectal pain started. So we're getting an indication as to the mental state of the remedy here. Crying, running the experience through her head, couldn't stop crying. Um, and I'll tell you, when we have somebody that has their emotions are so overwhelming that they're having difficulty controlling them, and typically crying um, is a big aspect of it. We can use the rubric hysterics or hysteria, right? But I know it's a term that's become kind of antiquated, but it's very useful in the repertory. And we'll see in one particular symptom that she talks about, it's under a very small rubric, I think with 3 or 5 remedies in it, that has the word hysterical in it. So I wanted to know, tell me about the changes and the symptoms you've experienced since then, since this incident, because this is what we would consider an exciting cause, right? The very clear, this experience happened, and it was so traumatic and so intense, it pushed her into a remedy state. She wasn't having any of these symptoms prior to this, so she wasn't in the remedy state. So I want to just point out that when we use ailments from, there has to be a really, really clear connection. You know, just because somebody's parents get divorced, we don't use ailments from neglect of the father or ailments from neglect of the mother. There has to be a really clear connection where the patient feels neglected. Anytime they feel neglected, they become symptomatic, or neglect runs through the whole case. Okay. If somebody says, ever since my grandparent died, um, I've been feeling sad. It's normal to feel sad. It's normal to miss family members who passed away. So when we focus in on remedies and we look for an exciting cause, there has to be a really, really strong, clear connection. And in this case, there is. Um, I get these intense headaches, and just pay attention to the words she uses to describe the headaches, because that's what we're really focusing in on. I get these intense headaches. If I get upset, the headaches will get triggered. So that's important. They're very intense and sharp pain in the right side of my head. It almost feels like a nail. Feels like a nail. So this is really important. Um, a nail isn't actually being driven into our head, but if it feels like a nail, there is actually a rubric where we can find head pains that feel like a nail being driven into the head. The pain shoots to the top of my head and down into my teeth. Hold on one second. Down into the teeth. Um, so is that a remedy suggestion, Ignatia? Ignatia does have a lot, and actually we have to do a differential on Ignatia with this particular remedy. But Ignatia would be a good first choice when you're doing a DDX, right? Because the process is case taking, case analysis. You see what is the ballpark that the symptoms put you in, and then we have to do a differential on the remedies. Um, but Ignatia, when I did my DDX on this, Ignatia was in the top four. Um, they're very intense, sharp pains. The pain shoots to the top of my head and down into my teeth. I can't sit in one position, and I keep shifting around. I tend to cry and complain when I'm in pain from these headaches. So there's a lot here. There's a lot of different rubrics that we could use to express all of this, and we'll get into that. If I forget, I'd like somebody to remind me. There are two particular rubrics. I tend to use one, and the one rubric that I tend to use doesn't fit this case, but the other one does, and they're almost identical. As a matter of fact, you could probably even combine them when you use them. I can't sit in one position. I keep shifting around. I tend to cry and complain when I'm in pain from these. So there's a lot there. How often do you get these? About one time every 1 to 2 weeks. So once a week to once every 2 weeks. I asked her to just tell me more, which is, a lot of what we do. Just tell me more about that. Tell me more about that, because we want them to paint the picture. We don't want to be painting the picture or adding our influence. Um, when I get upset, it triggers a headache, and then the pain of the headache makes me angry, and I cry very easily. I just want to die. I can't see any, as a matter of fact, right now, treating a case where the patient doesn't want to be here, doesn't want to. The pain gets so intense that they really question why they're here. There's a rubric that expresses that perfectly. I can't see any way out of it when I get them. The pains are so excruciating and intense, excruciating, intense pain, sharp pain. So we're kind of getting the picture and the understanding of the sensation of the pain. I don't want to be bothered and touched by anyone. That's another aspect of the case that we can get into. The pains last about 1 to 2 hours and then go away, and my head feels so tired afterwards. Um, so that's actually a separate rubric, but we'll get into that as well. So we always want to know anything that makes the symptoms better and anything that makes the symptoms worse. Modalities can make or break a case sometimes. Anything make the headache better or worse? Rubbing my head feels better. And typically what I want to know is if sleep makes the headache better, rubbing it makes the headache better, pressure makes the headache better, lying the hand on the head, which is not pressing, which is not rubbing, lying the hand on the head ameliorates. I want to know, okay, the pain is what number, and then it brings it down to what number if it ameliorates. So the pain's at a 9, and the rubbing brings it down to a 5 or a 4, we could use it. If it's a 9, and if the rubbing of the head brings it down to an 8.5 or an 8, I probably won't use it because the modality is not strong enough. Do you get other symptoms with your headaches or when you get upset? Sometimes I get cough, get hiccups, but not always. I also get this sharp pain, very sharp, intense pain in my rectum. So I asked to say more about this. It's very sharp and cutting pain. I get restless and need to move my legs until the pain goes away. So here we kind of see the same thing. The pain, where was it? I can't sit in one position. I keep shifting around. in here. I need to move my legs until the pain goes away. I can't sit and I can't sit still. I need to lie down and then sit, then walk a bit, then sit down again. Anybody want to, what rubric or what does that indicate as far as the pain and what the pain is causing the person to feel? Or what is it compelling them to do? I'll sit. I'm going to keep going, and if somebody wants to answer, you can. For how frequent are these episodes? About 1 to 2 times per month. So it's almost about as frequent as the headaches. She talks about PMS. I get irritable before my cycle starts. When it starts, this is something, there's a rubric here actually. Let me just take you to it quickly. My irritability menses before. There's 95 remedies in here. What I want to say is that of all the cases I've taken when the menstrual cycle is involved, irritability is usually involved somewhere. Um, and so, is it part of the case? It could be. Um, but I'm looking for things that are more strange, rare, and peculiar. So I don't think I used that particular in this case. So she gets irritable when the cycle starts. When you want to use irritability is when they're completely dignified, mild mannered, they never raise their voice. There's no indication of anger, irritability whatsoever. And then right before their menstrual cycle starts, they're just raving, everything's irritating them, they're yelling, and there's a huge change in their demeanor. That's when you can use it. And then she says, when it starts, I get these sharp cutting pains in my ovaries. And then um, I asked her multiple times. So we have the sensation, they were sharp cutting pains. Asked, do they radiate anywhere? Which is important because you can have different remedies based on where the radiations of the pains are. So they radiate into our legs, and which part of the leg, because some remedies can radiate to the back of the leg, a hamstring, some remedies, when they radiate into the legs, they can radiate down into the lower extremity below the knee, into the feet. In this particular case, they radiate into our thighs. Some doctors, when they look at pain extending to, they could just say lower limb. Okay. Um, it's hard to stay still, and I keep trying to find a comfortable position. So we've heard that 3 times already. Let me just show you. So under female pains, let's just go to ovaries, extending to. You see here. Let me just get a sip of water. Extending the direction can be important. We have extending to the abdomen, to the back, backward, to the chest, downward. There's also diagonal and upward, which is a very strong diagonal pain, are a pretty strong indication for oh, I can't think right now. But is Murex. That's the remedy I was thinking of. But diagonal, whenever you hear pains radiating diagonally, it's pretty important. Extending to the hip, to the groin, to the liver, to the opposite breast, that should be Murex, which it is. To the mammary, to the mammae, to the other ovary, to the sacrum, to the thighs. So it's pretty commonplace for pain to radiate from the ovary down into the thighs, radiating upward, radiating to the uterus, left and right. Also, if you have in a case, let's say the pains, in this case, right, pains are radiating from the ovaries downward, there's a place you can look under generals. And I'm not sure how much experience people have with the radar program, but what I'm doing is I'm just typing in generals, GN, and generals comes up here. I'm just going to go back. If I go to the binoculars here, what I'm doing is if you type in anything here like throat, TH, throat's going to be there. Just backspace. So generals, enter. chapter. Pains, bending, downward. So there's 55 remedies. I'm just showing you another strategy that you can use for pains if they're extending downward or if they're extending upward. I don't know if you saw there, there's also extending crosswise, cross, downward, the eyes, outward or inward, radiating, radiating pains. So let me just go back real quick. Sorry. So what we have here, um, also, so what we have to this point are we have pains. They're very similar, right? They're intense, they're excruciating, they're cutting, they're stabbing, they're radiating. Another word we could use for pain like this are neuralgic. They're nerve-like pains. We've got this need to move, can't sit still. We've got the mental state where she's crying, she's angry, she can't calm down. Let's see. So let me go back. I've got another sheet over here, a little cheat sheet. So this is the case analysis. So we have sensation, experience, just mental, emotional sensations, right? Um, we've had shocking, traumatic experience, very traumatic, crying and running the experience through my head, tendency to cry, complain when I'm in pain. And then when we're looking at the head, upset, headaches will get triggered if I get upset. So we've got a clear emotional component to the case. Intense headaches, very intense, sharp pain, feels like a nail. Pain shoots to the top of my head and down into my teeth. Pains are so excruciating and intense. Um, the head feels so tired. The pains that are causing, I can't sit in one position. I keep shifting around. Headaches make me angry and I cry easily. Sometimes she gets the hiccups. I just want to die. I don't want to be bothered or touched. Better by rubbing the head. We have the rectal pain, very sharp, intense pain in my rectum, very sharp and cutting. Restless and need to move my legs until the pain goes away. I can't sit still and need to lie down. And then then I walk a bit, then I sit down again. And then we've got the female ovaries, irritable before my cycle starts, sharp cutting pains in my ovaries that go into my legs and thighs. It's hard to stay still and keep trying to find a comfortable position. So the remedies that I do in DDX, the remedy that I gave is not in here, but these are the differentials. Cimicifuga is one, coffea, ignatia, bryonia, and zinc. So let's go up and I'm going to try to put this so I can have both of these windows open. So the headache, let's start here. Intense headache, right? But one of the things I want to focus on, it feels like a nail. So let's do a search. Nail. And then under the head. So I'm just looking in the different chapters. Head chapter. And typically I like to look under generals. So head pain. I'm not going to put the location in. There should be a rubric, pain as from a nail. So we can take this and we'll create a clipboard right here, as from a nail. Let's see. You can see one of the things I like to do, and I'll just talk about this for a minute. I'm really happy that we have a lot of additions and new information in Adonis, and I'm really happy that we're always adding information. But there's so much that are the information that we have from Borky and Boger and Hale and all the old homeopaths is so rich. And so sometimes what I like to do is I'll look in Adonis, but then I'll go back and I'll look. And I want to show you something here. And we'll look in Boger as well. Internal in the head. That's from a nail or a plug. Murphy real quick. Murphy's got a lot here. Okay. So does anybody have anybody want to add in maybe what they would a rubric they would use or something that they would focus on here? Something we'd want to repertorize. We've got intense headaches, very intense sharp pain, feels like a nail. We've put that in there. Pain shooting to the top of the head and down to my teeth. Pains are so excruciating and intense. One of the ones I like to use when she said she gets angry, right? There's two rubrics we can use. One is just get to the right repertoire. We can go to mind, irritable, from headache, right? Anybody want to guess what the other rubric might be we can use? Under head, pain, maddening, maddening pains. These are pains that cause them to get people to get upset. So what we'll do is see there's Ignatia, but the remedy wasn't Ignatia. Irritable during headache, maddening. Want to combine those, group those together. We also want to look at head pain, neuralgic, because the pain is shooting around. And if you notice, a lot of the rubrics that I've used so far, they're about 40 to 60 to 80 remedies per rubric. That's a good size. So usually once you start getting over 120, it's okay, but you're really casting a wide net. When you get up to 300, 400 remedies per rubric, it's too much. It's so vague. There's no specificity, and that's really what we're trying to focus on and look for in the case is we're trying to find what makes this case strange or peculiar, right? What's the bit that doesn't fit, which one of my old teachers used to say. So we've got head pain neuralgic, added that in, right? We've got head pain piercing. Piercing pain, right? Because what does a nail feel like? Feel like it's being pierced. Um, one of the other things that applies to this case is the word nervous. Nervous headaches. Nervous headaches are for people that the nervous system is involved, the emotions are involved. Um, so we can definitely use this in her case. The other thing is what happens if she gets upset, head pain from excitement, emotional excitement, right? So we put that in there. Oops. I'm just grabbing the rubric and pulling it in. Oh, the other one is head pain, violent pains. So violent is extreme. And when you have somebody that's kind of, you know, crying, they can't control themselves, they can't sit still, it's pretty intense pain. Um, No, she was not loquacious. She was not loquacious. I would not have used that in her case. Good question though. I appreciate the question. Um, the other thing I want to show you is head pain type of head pain type. Um, Excruciating. Put in head and excruciating. Let's see what comes up. Okay. Head vertex pain extending to teeth. Okay. Um, so this was actually, I don't know if I had said it there, and if I wasn't clear, I apologize. But it was actually right-sided headache. Let's see, where did she say? Sorry. Very intense sharp pains in the right side of my head. Pains shoot, so from the right side of the head, they shoot to the top of the head. That rubric or the what you suggested was pain in the vertex shooting down into the teeth. So that would not apply to this particular case. We need right-sided. I didn't use right-sided because right-sided headaches have, I forgot how many remedies, but many, couple hundred, 250 or so. But if we look up, I wanted to show you this. This is why I put in excruciating. Under Boriki, he's got head, headache, character of pain, excruciating and violent pain. And this does fit her case. And then the other thing I wanted to bring up in Boriki, which you won't find in Adonis, is headache type. And we've got anemic headaches, catarrhal headaches, congestive, gastric or bilious. And in this particular case, it's nervous or migraine headaches. So I use that in this particular case. Yes, yes, she was there was weeping, crying, inconsolable crying with the headache. Um, Good questions. So the other aspect of the case, so we've characterized the sensation of the head. Oh, there's one other thing as far as sensations. The head felt very tired, and oops, let me get to the right rubric, right repertory, sorry. Head, head, tired feeling. And if you notice here, there's a Kunzli dot. I'm actually going to be doing a presentation on the Kunzli dots and the different rubrics. Jos Kunzli was a homeopath who apparently trained over 4,000 other homeopathic doctors. And what he would do in his practice, he would put a dot or a note, Kunzli note, on the rubrics that he found most clinically valuable. So in synthesis, in Adonis, if you're going through the repertoire and you're looking for symptoms and you find um, this little red dot, this is a Kunzli dot. And so what it means is that Kunzli found this particular sensation of a tired feeling in the head as very useful for the remedies that are in here. Um, and there are many Kunzli dots. There's Kunzli dots for all kinds of things. There's Kunzli dots for appetite and um, emotional states and dizziness and all kinds of things. Just as an example, another one would be vertigo, looking out the window. See, here's a Kunzli dot for Natmir is a grade 4. So some people that need Natmir can get quite dizzy when they look out the window. So it's just another example. But I'm putting together a presentation on the Kunzli dots. So we got the tiredness and the headache and the head. We've got the intensity of the headache. Let's see, there's a rubric for head pains radiating. It's not reading in all directions. What was the rubric? And tired sensation. Um, one of the other things that it caused, right, was this moving around. So what I typically use is restlessness from the pains. Okay. This is a very good rubric. I use it whenever it's present. So this is essentially people that can't sit still. They're in pain and it causes them to shift around, to shift position, to get up and walk, whatever it might be. And you can see you've got these sub-rubrics here. There's from neuralgic pain, from pain in the abdomen, from pain in the back, from ovarian pain, from sciatic pain. This is the one I typically use, but the remedy that I gave is not here. So what we'll do is, it's just as an exercise, we'll put this here. The other rubric that you want to be aware of that is, I would say almost synonymous, is generals, change, position, desire for change of position. This is the person that needs to constantly move and change their position, right? So they're both saying very, very similar things in slightly different ways. Under generals here, it's just the person needs to change position all the time. Sitting, walking, crouching, standing up, changing position in the bed. And we can see here, Rustox is there, Arsenicum is there. Interesting that Bryonia is there because Bryonia doesn't usually wants to sit still, right? So, but we see here Boger, Jar. So we've got some really good authors that have confirmed this symptom. So we have that. And then I would just want to go into Boricky. I think I'm kind of emphasizing and showcasing Boriky's work because the remedy was in one of the rubrics we put in there under Boriky, but it wasn't there under Adonis. So Boriky, ameliorated position change of Boriky, that's one, and Boger as well. Condition, position, change of position, aggravates. There's a rubric for without relief. Change of position. Give me 1 second. There it is. Must change position. That's the one I wanted. So let me just go to the clipboard real quick. So we see here desire to change position, ameliorated changing position. Well, let's take that out because it doesn't ameliorate. But restlessness from you can see, I'll just show you guys here. The remedy that's kind of creeping up is zincum, valerianium. Valerianic, it's spelled different ways in different books. Let's keep working on the case, but desires to change position, zincum val is there. Position must change, zincum val is there. Restlessness from pain, zincum val is not there. It should be there. Okay, so we're just going to combine for the case of for repertorization, we'll group. Not sitting one position. The other thing I wanted to show you as far as mental state goes that I use for this case, mind, despair from pain, despair with the pain. I'll put that in there. And then we can see zinc and Val is there with three Z's. And every time you have three Z's, it means that the actual rubric is underneath the rubric that you're looking at. So we can see for pain in the head, and all the author here is Farouk Master, MTF is Farouk Master, and zinc and Val is there. The other one I wanted you to look at is lamenting. And Massimo Magnavori has put that Valeriana. One of the things when you study this, you'll see that in a lot of these rubrics, especially when it comes to pain, Valeriana, which is where part of this remedy comes from, Zinca, and Simicifuga will all kind of come up in a lot of the similar rubrics. I use this particular rubric, Zinca, lamenting about pain. What else did I use? All rubbing. We use head. What I typically do here when there's a modality, I'll type in rubbing, ameliorates the head. And you'll see I put that there. And then usually there'll be a head pain rubbing. Ameliorates. And you see that rubric is bigger. The first rubric had 15 remedies in it. This one has 40. And then if we go to generals, rubbing, ameliorates, 180. So what I usually do there is that I'll combine them. Rubbing, rubbing, rubbing. Then you see zinc and Val is not there. And this is another example where, here, I'll show you. Zinc, Valerianicum. And look up rubbing. You'll find it probably in Bulgar or Bulgariki. So this time it's under rubbing aggravates, Fatak. Fatak must have had rubbing ameliorates. Rubbing or stroking ameliorates. That's where I got the rubric from. So one entry for zinc and Val, or rubbing or stroking ameliorates. And then in synthesis, they've got zinc and Val, rubbing, stroking aggravates. I wonder if that's actually true. The way you would look is under references. Let's see, attack materia medica, results rubbing, synoptic key, Bulgar rubbing. They're not specifying here. Oh, better by rubbing. So I think that that may be a mistake we just found. I'll have to let them know about that. Because Fatak, as we look at Fatak's materia medica, says rubbing ameliorates. And then when we look under his repertory, rubbing or stroking ameliorates. And then in synthesis, rubbing aggravates. But I do remember coming across rubbing ameliorates, which is what helped me to come to the remedy. We talked about the shifting around. We talked about the maddening pain. I just want to die. So that's despair from pain. Okay. We look up hysteria and hysterical. This will give us a lot of information for this remedy. Hysteria. This was the rubric that I was looking for. I had mentioned at one point, sometimes when she gets really worked up, she's got the headache and she's crying. Let me find exactly what she said here. Let's see. Rubbing the head, triggers a headache, crying. Oh, here it is. Do you get other symptoms with your headache or when you get upset? Sometimes I get hiccups, but not always. So you can see she's very worked up. She's in a hysterical state. So we go back here to the repertory. Stomach, hiccups, hysterical. Got Gelsemium and Ignatia are actually in the same. They're in the same plant family, along with Nux, which is Loganaceae. Muscus is another big remedy for hysteria, and so is Nux moscata. Nux moscata is nutmeg. It's got two polarities, right? The one side has this excited state, and then we know Nux moscata very well for the sedated state where there's overwhelming sleep, but it can also be an excited state. Um, but there's zinc and vow as well. And you've got Fatak and Oscar Boricki as the authors. So this was true in her case as well. Um, I just want to show you, now that we know what the remedy is, and we're about 40 minutes in, let me just type in ovaries. And let's type in female. Yeah, question quickly. Can you help me understand as a student, since it's known that each remedy holds polarity in its formless character, I find myself wondering if theoretical case can be searched and pursued. Oops, rubric, borky, rubbing. Okay. Know that each remedy holds polarity. I understand what you're saying, and I appreciate the question. Um, we would really like to see that in the Materia Medica, if because and if I'm misunderstanding your question, I apologize. But if yes, remedies do hold polarities, but they hold a polarity in let's say in Staphylos aureus, you've got rage, right? Throwing things, violent sudden rages, and completely suppressed anger, where you don't see the anger whatsoever at all. It's all that would be a polarity. Um, in modalities, it's a bit different because in modalities, I appreciate your question, and there is something to the polarities. Um, but let me give you an example. In generals, we know very well um, motion tends to aggravate bryonia, right? So motion aggravates, and you've got bryonia. And we also have motion ameliorates. And under motion ameliorates, you're gonna have bryonia, but it's a grade 1, right? And when you go through the repertory and you look at bryonia and its relationship to motion, I would, in the overwhelming percentage, 60%, 75%, somewhere in there, maybe 80%, you're gonna see the sensitivity to motion and motion aggravating in relationship to bryonia, whereas movement ameliorating. Here, let me just pull it up real quick. And I'm just using bryonia as an example because it's so well represented. Um, let's put motion aggravates, which is what we tend to know for bryonia. My computer a second. So motion aggravates, vertigo motion aggravates, grade 3. There's 244 results. Even if we go to, Boriki, headache, motion aggravates. So 244. And the other thing we can do actually, let me get rid of the grade 1 and grade 2. Let's do that. That'll be even more, I think. That's a good example. So there's 4 gradings, right? There's grade 1, which is just normal type, grade 2, which is blue italics, grade 3, which is like this, red and bold, and grade 4, which is red, bold, and underlined. Let's see. There's motion, slight motion aggravates brownie. So there are 66 rubrics where bryonia is a grade 3 or a grade 4, mostly grade 3 for motion aggravates. Let's do motion ameliorates. I would be surprised if there's a 3 or 4, at least 1 or 2. So there are. Oh, Aboriki puts aggravate and ameliorates motion, ameliorates by motion. But let's look at, there's nothing in synthesis, but here lower extremity motion ameliorates, brownia for Boger. This is aggravates. This is aggravates. This is aggravates. So this is a little bit misleading, I think. Motion of the head aggravates. It's strongly indicated for aggravation for motion, and there are a few rubrics. Let's see what Boger said. Motion aggravates. So getting back to your question, there are definitely polarities, which is just another layer of homeopathy, which makes homeopathy very confusing. It can make it confusing. But in modalities, there really is a strong polarity emphasis or connection to one particular um, modality. In the case of Zincum valerianicum, the rubbing was not that strong, but it was present. Ovaries. Yeah. I had one other case of proctalgia fugax to share, but I wasn't able to type it up because I've been sick for the last 2 days. Maybe I'll share it next time. I've got some trigeminal neuralgia cases that I'll be sharing. So we have here for Zincum bowel, complaints of the ovaries extending to the thighs. We've got that there. Neuralgic pains, which would characterize what she said. Pains in the ovaries extending to the thighs. Cutting pains, and she even described, I think that was stabbing or cutting pains. Here's something very interesting. Male and female genitalia music ameliorates. Did not see that in this case, but if you ever have that, somebody's got ovarian pain, uterine pain, and they listen to music and it ameliorates, your remedy's got to be in here. You got lachesis, magphos, moscus, and zincum bowel. Very interesting. I didn't know that rubric existed. Murphy's got quite a bit for zincum valerianicum. Pain in the ovaries, ovaries extending down to the thighs, dysmenorrhea, painful extending down to the thighs. Any other questions? You're welcome. So we've got the headaches, head sensation. Oh, so there's actually a rubric. Farouk Master's doing a really good job of widening the pathology and the pathological rubrics, meaning putting the actual name of a disease in the repertory in modern terminology. So if we go to rectum, we go to pain, we go to anus, what's the rubric? There it is, proctalgia fugax. So, and there's a little flag there. The flag usually indicates the blue will indicate usually how the symptom presents, or the definition. Functional anorectal disorder is characterized by severe intermittent rectal pain that is self-limited. The diagnosis of proctalgia fugax can only be made when all other causes of rectal anal pain are excluded. They're saying fissures, hemorrhoids, so on and so forth. Anyway, so you can see the author here is Farouk Master is the author for all of these remedies being put in this particular rubric. And there's Zincum bowel down there as a grade 2, and there's Ignatia as well. Let me see if there was anything else I wanted to cover. Oh yeah, there's a couple more things. We have the cutting pains extending to thighs. Um, and then the other thing I wanted to do, just go to the pocket manual. Zincum valerianicum, a remedy for neuralgias. And this is, I believe it's Boricky. Let me see. Pocket manual. Yeah, it is Boricky. A remedy for neuralgias, hysteria, angina pectoris, which would be sharp pains, and other painful affections, notably in the ovarian affections. So you've got the headache, you got the ovaries, you got the chest, you got the mental state here, kind of hysterics, epilepsy without aura, hysterical heart pain, facial neuralgias. If I'm not mistaken, if we go to face pain, trigeminal neuralgia, there's zinc and valence there as well. So it's good that it's there because it just lets us know if we need to use it. This is another rubric that I use for pathological cases when you've got, somebody with trigeminal neuralgia. You can use this rubric to narrow down the remedies you're searching for. And I would say 85% of the cases, the remedy's in here. Another 15% of the time, you gotta kind of widen the scope of what you're doing and look for a remedy that hasn't been put in here yet. But always following the uniqueness of each symptom. Head, violent neuralgic pains, intermittent. Here we have obstinate hiccups, becomes almost insane with the pain, which is piercing and stabbing. Oh, the other thing, let me just go back here real quick. Head pain as from a nail. Zinc and Val is not there. But when we looked on, I think it was Boricky, head pain piercing as from a nail. So it hasn't been added yet. There's Oscar Boricky. So it is under head pain as from a nail. It's just not in synthesis. Becomes almost insane with pain, which is piercing and stabbing, uncontrollable sleeplessness from pain in the head with melancholy. Overalgias. Algia just means pain. So ovarian pain, shooting down the limbs, even to the foot. Didn't see anything about that in the repertory. So keep that as a footnote in your mind. It doesn't just always go just to the thighs. Severe pain in the neck and spine, cannot sit still. We see that over and over again in the case I just presented to you. Must keep legs in constant motion, sciatic neuralgias. That was something else that I saw when I was studying this remedy. They cannot sit still, must keep legs in constant motion. So the way we look for that, motion, it must move. We just search these separately. Lower extremities motion involuntary. That means restless, impulsive to move lower limbs. So we've got carboveg, causticum, mercurius, sepia. What's interesting, you've got valeriana and zincum as a grade 3 and a grade 4, and then you've got zincum valerianicum in there as well. And then lower extremities ameliorated. So if you have somebody with lower limb pain, especially sciatica, very excruciating, and they must move the limb, you want to consider these remedies here, including the zincum valerianicum. Question. You're welcome. I have these remedies that come up. Manzanella and scutellaria. Manzanella tends to be a remedy that's a lot more, you would see fear of evil, fear of cancer, fear of losing their sanity. And we didn't really see much of that in here. Um, I need to look at Mancinella and studying it in relationship to the neuralgic pains. Um, Scutellaria, yes, I would put that Scutellaria in there as a differential as well. One of the things you can do, I'm just going to close this out. One of the things you can do is Scutellaria, uh, Mancinella. You can see what rubrics they share. Under Murphy, violent head pains, yes. Restlessness, mental insomnia, and Schroyen. These are the big rubrics I'm talking about. They're just too big. 834 remedies. Sensitiveness to pain, head pain, violent. So they do have some overlap, but really, really, really far out as far as how general the symptoms are. But so we can see even in the repertorization I did, the zinc and val is there. Belladonna would need to be DDX because of the intensity of the pain. Coffea for sure. Ignatia and Nux. What we see here, Ignatia, whenever I repertorize and I see more than one remedy, so two, three, or four remedies that are the same plant family, same line or same row or column in the periodic table, I tend to look at those as a group and see, why are these remedies coming up as a group? So Ignatia and Nux are there. China. So let me just go back. I can kind of see what happened. I gave her a 200C. So 200C, 5 pellets once, follow up in 4 weeks. Since I took the remedy, I've been feeling better. I had one slight headache 2 weeks ago, but didn't last as long. It wasn't as intense. It was a 3 out of 10 instead of a 9 out of 10. Definitely moving in the right direction. Rectal pain, she didn't have any problems or that month. When was the last time this happened? Oh, let's see. Let's see. Feeling lighter. I'm sorry, this is a typo here. Yeah, feeling when I what I like to do when I follow up with a case is I want to see, are the symptoms getting better and does the patient feel better? And in this case, I usually ask them, are you feeling differently in any way? And I can tell you from 22 years of experience, if you give a remedy and let's say the headaches are better, but they're still just as anxious, still just as irritable, still just as depressed, the remedy's not going to hold. The response to the remedy's not going to hold. Because what we're doing with the remedy is we're opening up the vital force, right? So what's in the pellet is not curing the patient. What's in the pellet helps to reharmonize the vital force so that the cure can then follow, right? Because that's what's really healing the patient. The remedy is just stimulating the vital force to heal itself. So when you get the right remedy and the vital force, the channels for the vital force open up and it's reharmonizing, the patient will invariably say, I feel better. I'm more at peace. I'm more grounded. I feel more at home in my body. They've said it so many different ways, but in essence, what they're saying is, in general, I feel better. And even Hahnemann has said, if you want to consider something to be a medicine or medicinal, it has to change how a person feels. So I ask that quite often. How are you feeling? I'm feeling lighter. I seem more stable emotionally and not as easily cry or get upset. Subsequent follow-ups continued to show improvement, and after 12 months of treatment, she claimed 95% improvement. Um, I believe this right here, it's supposed to be here, because I did ask her at that point, and it had been so long that she just kind of forgot about her pain and everything. It's a really good case, really good remedy. Small remedy, right? Not one most of us know. Um, but that's the work that we do, right? As we could be I can be in practice for 20 years and not know a particular rubric or not know a particular remedy. So it's a constant process of learning. Um, so I treated this person for about a year. We did follow-ups a year after the initial consultation, and I haven't heard from her since, but she did really, really well. So that's the case. I've got, okay. How do you select potency? So as a general rule, as a general rule for potency, I tend to give lower potencies, like a 6C, if the patient is weak, if their symptoms are purely physical, so not much mental or emotional aspect to the case. Um, if they have a mix of physical complaints and emotional complaints, I usually start with a 200C, especially if their vitality is relatively strong. Here you've got a 27-year-old female. No other really, no issues with regard to no medications that might overwhelm the response to the remedy. She's not old and debilitated, so I'm not really worried about that. Um, so it's a combination of physical and mental emotional. I'll start with a 200C. If we're getting up into the dreams are being affected, the behavior, it's more behavioral, like autism or something like that, I usually start with a 1M. Um, with that said, sometimes you get a sip of one. As a general rule, with acutes, I almost always give 30C in water. I'll have a patient do like a fifth to a quarter cup of water, put 2 to 3 pellets in the water, stir it, and take a teaspoon. Usually 1 teaspoon is the other do, or take 1 teaspoon every 3 hours, depending on the intensity. Um, but with acutes like this, it's okay to give it 200C and wait. But those are my general rules for dosing. You're welcome. Yes. 12 months of treatment. Well, she was given I'm sorry. So she was given 200C, and then at about month 4 or 5, she was given a second dose, and then she didn't need any more after that. So, all right. Well, thank you all. I think that was it. I'm just answered that. So she got 2 doses. She got one at the initial, and then about 4 months later, she got a second dose, and then she did really well. As far as dosing goes, once you feel like you're on the right remedy, you just dose as needed. But we always, just very judicious in the redosing. In this particular case, she didn't have an aggravation, which is something else that we have to consider. Um, if there's an aggravation, we have to